Hey everybody, and welcome to the Thursday of Pride. And today we're going to be having a panel discussion about queerness and disability. So I've got an amazing whole gaggle of panelists here. I don't really know what the plural is for panelists, or is it just panelists? But we've got a great group here today, and I'm really looking forward to introducing you to them all. And I think we're going to have an amazing discussion. So I am going to go to Claire first, if you want to do a quick introduction.
Hi, I'm Claire. I use she, they pronouns. I've been living in Galway for all my life, actually. Need to get out more. And I am actually a committee member with Galway Pride this year. I'm an OCM. So yeah, I'm really, really happy to be here. Really honoured to be here, and yeah, looking forward to it.
Oh, fab. No, thank you for being here. I'm delighted to have you. Anna, over to you.
Hi, I'm Anna. I use she, her pronouns. I'm also from Galway. And yeah, I find disability is probably the primary thing that affects me day to day. I am unable to work. So yeah, it's complicated. Like, I don't have easy answers for even the question, like, what is your disability? It's quite complicated. So yeah, and invisible also. So that would be kind of my experience is, just people don't see this disability when they look at me, and they don't really understand the actual substance of my life day to day. So it would be nice to talk about that a bit today.
Excellent. Well, that's what we're hoping to do. Anya, over to you then.
Hey, I'm Anya. I use she, they pronouns. I'm an artist and designer based in North Mayo. And I'm from Mayo. And sometimes I live in Dublin for work when I can, but spend most of the time here on my laptop. Yeah, I make a lot of work about my disability and about sort of access in the arts and lack of access in the arts in lots of ways, not just in terms of disability. Yeah, I think that's all.
No, that's brilliant. Well, lovely to have you. And last, definitely, most certainly not least, or Dr. Shivangi, if you want to take the floor.
Hi, I'm Shpaggy, who cannot actually say their name right now because they are suffering with the allergies. What do I do? I doctor sometimes. I write and create art as much as I can, and I am very terminally online on Twitter, and I very much talk about disability, and I suppose for me, the disablement of chronic illnesses. I have an interest in working in mental health, having a lot of lived experience of my own mental health issues, and I'm a trustee for a charity called Choice Support in the UK, which is service user led, and it's specifically for people who are neurodivergent and people who are mentally ill to access areas of employment, personal relationships, housing, and just opportunities to find community. So yeah, I do things sometimes. I'm very happy I get to do this, and yeah, I am also some flavor of queer, and I think those things and the way that intersects with race and disability and all of that, they're things that I can't avoid, and so they're things that I think are really important to talk about.
Oh no, that's so true, and thank you for that. And especially when you're not feeling 100%, thank you so much for still coming along. I also realised I never introduced myself, which I love. So hello, I'm Sharon. My pronouns are they, them. I am also on the Galway Pride committee this year for my sins. I keep saying I'm done, but they keep roping me back. And it's an absolute honor to be able to facilitate this conversation today. We have a couple of different topics, but it's probably going to be a pretty open discussion because all of us have different lived experiences of being disabled in different ways, and I'm really looking forward to seeing what kind of topics we go through. But I guess it's hard to kind of talk about disability or chronic illnesses and not talk about it in the lens of our current global pandemic. It's why we're doing this remotely. It's why so many things are going to be changing probably about our day-to-day world. So I guess if anyone wants to start with talking about how the pandemic kind of intersects with disability. Maybe Anna, I'll go to you to start us off.
Sure. Well, I mean, the last year, or year and a half now, really, it has been very rough for a lot of people, physically, mentally, emotionally. What I found interesting was how little my life actually changed day to day. From, not going out much. Part of that before was lack of energy. Part of it was lack of money, seeing generally everyone in the country suddenly have to live like me and find it appalling, and find it difficult, I suppose. In a weird way, was validating in the worst possible way, because I hadn't realized how stressful that was for me. But my disability isn't going away. It's been 13 years now, so I'm not sure even when the pandemic's over how much my life is going to change really even from now. And part of that is internal, it's my health. Part of that is external, as I say, it's lack of money and everything else. And those are the parts that I find frustrating. So that's been my kind of experience, I guess, of the pandemic.
Shivangi, as someone who is kind of working on the front lines, I'm sure you have a very kind of different kind of, or not different, but you've got a really interesting perspective on it too.
Yeah, it was a strange time trading into a pandemic. I think we heard a lot about, how valiant all the doctors last year were. Jesus Christ, yeah, absolutely. But at the time, as a person who's on immunosuppressants, for example, I was fighting for the fact that students wouldn't be volunteered into ICUs at COVID wards, just because it was never mandated that you did it, but it was always highly recommended, and it was never certified. You never got anything formal for it, but of course you'd be well looked after in the future. So having to stand up against just openly stuff that we would not have been indemnified for, we would not have been looked after for, and being laughed at even by peers when they were like, but sure, bad things will never happen. It's to some extent, your other privileges interact. You are white and settled and Irish, and you have health insurance. You actually don't have to worry about what happens if you could go to volunteer and do this. I do. I don't have health insurance. I don't have any recourse to public funds here. If something bad, if the worst were to happen to me, my family couldn't come to take me away. Yeah. I think that was it. It was a very stark time for a lot of realizations. And for me, it actually just made me realize, I guess, parts of my own disability that I'd been ignoring for other people's sake and other people's convenience. So I very much came to terms with using the language of being I have ADHD. I kind of decided to skip the whole, waiting for a diagnosis or whatever. I was like, look, if they trust me enough to give me a medical degree and they trust me enough to prescribe for other people's lives in a hospital, that I think I can trust myself to say, I have ADHD and this is how it affects my day to day.
Yeah.
And there were parts of that were good and parts of that were bad. Like, I found working on a screen way worse than any of the isolation. Worse than anything else was this whole translation to digital working. Like, now in a hospital every day, you know, shit's hard, but I can get by doing quite a lot if I'm constantly physically on the go and constantly working on paper and with real people, like in a very tangible sense. So I think that was probably the most debilitating part of the pandemic, the shift to remoteness, or even the shift to assuming that remoteness was a good thing, that other people being able to be in your home in a virtual way was a good and fair thing when you didn't really feel safe anywhere. So yeah, it's brought out quite a lot of stuff. I mean, you know, now I'm working in the hospital with the highest rate of COVID patients returning. Like, I've worked weekends where we've gone from 0 to 4 wards being almost full. At the height of the pandemic, we had 4 full wards. Well, 3 full in a bit. So it's quite an interesting journey as a clinician. And, you know, for a while over the last winter, I was in a hospital in London in a mental health, well, not really a mental health facility, but a mental health service with home services and community services. And I was there the day England had the UK had its highest deaths from COVID. And looking at, you know, what people consider mental illness or disability versus this general unwellness that we all got so scared of. Like, a couple of years ago, no one would have been worried if you had a couple of sneezes. You should have take some paracetamol and move on. By last winter, we'd gotten to a point where everybody was so scared of the slightest sign of unwellness that I think it added a huge amount of stigma to people who were already disabled, or just to be perceived as in any way chronically ill just became this much bigger thing. So yeah, I saw quite a lot of change around how people conceptualize ill health, I guess. Because you could talk about ability and disability, and that usually relates, as you actually quite rightly said, Anna, to this limitation of our ability to work or produce labor or whatever. And then there is wellness and unwellness, which is kind of how you feel in yourself or don't. But at the end of the day, it's all how transient or permanent ill health leaves an impact on your life. Like, I think, you know, anybody now who's going to have had 2 weeks of COVID or 3 months of COVID, even if nothing else happens, they're going to remember the impact of that for the rest of their life. And I think as a healthcare professional, watching people reckon with that when you're already disabled and you've already been stigmatized because of it all your life, that was quite interesting. I'm sorry to be a downer.
It's all good. Like, it is. It's reality at the moment. And like, look, a lot of my chronic illnesses started creeping up like in the last 18 months, and trying to navigate a health service that was like already a bit of a mess, but is like, okay, so everything is going into COVID now, and dealing with that unwellness while also being like, hey, so those other services, those like services that are like, what was the word that they used? Oh, the elective services. And you're
services,
like, yeah, and you're just like, actually, I kind of need that to live.
Oh yeah, I mean, like, even for myself, it was very strange, you know, trying to find, oh yeah, this is a diagnosis that I'm seeking. And they'd be like, no, but you're just being one of those crazy people seeking a diagnosis. Whereas I was on the brink of a life-changing, like, physical health diagnosis. And then they were like, 8 months, sure, what difference does that make? It'll just come back and it'll be fine. It'll be resolved by then. Like, both of myself and my best friend who lived together, we've both been trying to get services in our own hospital. And we can't, like, the service provision just isn't there. It's not out of ill will, it's just, it's a system that refuses the services of people who want to join it. There's only so much you can do.
Yeah. So I said we could go down the rabbit hole of systemic and chronic underfunding of our health service, but we know that is basically a fact.
Right, I'm going to turn off my camera and Mike will carry on.
It's all good. I said just come and go as you need. But Anya, perhaps over to you about the impact of COVID, especially on the arts.
Yeah, I mean, also I'll probably be a downer. Like, there was one good thing in that working remotely for me was like a great improvement, and led to like way more flexibility and sort of much more understanding. At least for a period of time, it feels a little bit like the understanding sort of by able people is kind of like disappearing a little bit now. But at the height of it, I was able to work on projects that I would have never been able to work on before, just because I was able to do it from bed. But like, as you were saying, kind of everything else in my life just went completely downhill because of the pandemic. And like, trying to, like you were saying about like elective, like services, like kind of everything that helped my conditions was suddenly just not available anymore, or was like 10 times harder to get access to, and required like fighting and energy that I don't have. And kind of like, I suppose any small social life that I had kind of disappeared. And any kind of things that made my life a little bit easier, like practical things that made my life a little bit easier, sort of disappeared as well. And it was all just like this overwhelming trying to navigate everything, and also like protect myself and my family from getting something else. And I mean, in terms of the arts, it was just like destroyed. Like, everyone sort of had to stop working, and there's lots and lots of loopholes in terms of government support, that meant that lots and lots of artists couldn't get any help, or were just kind of told to go on like the regular dole, which doesn't pay anyone's rent, or anything else. So it was pretty like devastating for the entire industry. And unless like you're in the section of the arts that kind of has like wealthy families, or, you know, somewhere to live that you definitely won't be kicked out of, kind of lots and lots of people just had to leave the industry because it was already like on its knees, and then it just became completely unsustainable. And yeah, a lot of people a lot of disabled people and chronically ill people had to just stop working in it because it wasn't possible anymore. But yeah, that's been my experience of it. So there was the one plus of I can do things on my computer a bit more, but otherwise it's been pretty difficult.
Yeah. I know for sure. Like for some people, remote work is fantastic, but it does take for granted a lot of things in a person's life, like that they have good internet and they have the space to do it, or have the safety to do it. And like, it's unfortunate, but yeah, I would love for it to continue being an option. It's one of the only reasons I'm able to work right now is because I work remotely.
I think that it's very upsetting to see things kind of coming back to normal, and like, or normal, you know what I mean? And kind of meetings that like I've done online up until now that were, or like a phone call or something, people are kind of saying, oh, well, won't you just come to Dublin for this? And then I have to go through the whole thing again of like making a list of like all of my needs, and kind of fighting when it was so doable when they were affected by it.
Yeah.
And even though you are aware like of people's privilege, it's been so clear this year and has made me like question relationships and friendships, because of kind of their sort of like ignorance and like actively ignoring how we live our lives and how we have to live our lives. So yeah.
Yeah. No, it's been a rough old time. Claire, over to you. About pandemic and all of the great fun of already being like disabled and navigating it all.
Yeah, I suppose I related to what Anna said, was that my life felt like it didn't change a huge amount, that I was already very luckily not long before the pandemic started was able to get on disability allowance, so that I had already dealt with not being able to work and having to deal with like income problems and all that jazz, and that I got that somewhat handled before the pandemic hit. But yeah, just my everyday life, yeah, I feel like it didn't change a huge amount. It did affect the little special things that I would have, that like I would go to a queer social group every Saturday in Galway, and that would be sometimes the only time I would leave my house that week, and that was really nice, and to see people in person and to feel that human connection. Or the cinema, which is I could do on my own. I could take my time before and after. I could, yeah, it was an enjoyable, I guess, solo thing that I could do to try and help improve the quality of my life too. Yeah, things like the cinema and just being able to go out for lunch, because cooking is quite a difficult thing for me. So things like that, yeah, when they just weren't an option anymore. And sure, I was used to being at home a lot, but it's kind of different when you're forced to from an external source. I don't know. It's one thing to have to battle with not being able to because of yourself and just like your own body or your mind or however, whatever reason. But yeah, when things just literally aren't open, or you literally weren't allowed to go outside, that's so funny. In the camera, I went to go for that side for my hair. Sorry. But yeah, so it was fun. But yeah, in the middle of all of that, then there became like the point you made, Anya, about how everyone needs changed. Like everyone was working from home and everyone had to stay at home. So in certain ways that improved accessibility for certain things, but in a really maddening way. It couldn't. Yeah, it was hard to see it as just solely a positive. That, oh great, I can go to this meeting now, or oh, I can do this over email, or whatever it may be. There was a little niggling thing that they wouldn't offer this accessibility otherwise, or this level of accessibility has always been out of the question. Not even thought of, not even like, so it's been tricky. And then seeing how people have been how able-bodied and I suppose people have been affected and how hard they've been finding it.
And what I found really hard was the PUP rate being nearly double disability allowance, because that was what was considered the minimum acceptable level of income for people to be comfortable. It was €350 a week. And meanwhile, those of us unable to work through no choice of our own are supposed to survive on 203 a week, which is the same as job seekers allowance, which is supposed to just tide you over but be shit enough that you're encouraged to get a job as fast as possible. And yet for those of us who need to rely on it's the same standard of living. It's I honestly at some point felt like I was being treated like half a person. If that was the full amount. I mean, living wage as well is 500 a week, roughly. So I'm at 2/5 of that. And that's gonna probably stick with me. You can work on disability allowance. You can earn a certain amount. But I've never had the courage to even try because of the process of dealing with social welfare to begin with was so horrendous, so confusing. The questions that they'd ask me didn't make any sense to my situation. And the so-called experts then would not be able to actually help. So I found it horrendous, and I want nothing to do with them ever as much as possible. Even if that option technically is there, I don't have the actual urge to do it.
But even
always the background. Oh, sorry, Char.
Oh no, you're grand.
There's always the background fear of if you're on disability allowance or job seekers or whatever, that any bit of work at all could throw a huge spanner in the works and could ruin everything. And it is, very, very difficult to get to a stage where you have managed to get a stable income. And even if it
it's definitely an improvement, over, because I was on job seekers a long time as well, because so my primary disability, I don't mind talking about it, is because people don't really kind of know about this shit. It's a sleep disorder, so it's a circadian rhythm disorder, so my body will only let me sleep between 4 a.m. and noon, mostly. These days it's 6 a.m. and 2 in the afternoon, so that's fun. So that's been going on. I mean, people get insomnia and they kind of have this, it's tough, but you push through and you're just sleep deprived or whatever. It's been like this every night for me for 13 years. I've tried everything, I really have. So I'm at the stage of my life where I accept it. I arrange my life around it. It also leaves me with very little energy. So I wouldn't be capable of working a full-time job, which is why then I'm unable to work, because I'm unable to support myself fully. So that is very hard, because even fun things, if they're in the morning, I can't be there. I can't go back to school. I'd love to, that would be amazing. But I wouldn't have the energy to begin with, and I also couldn't be there. And the understanding is not there for this. Even when I was on job seekers, I would go to a lot of job interviews and be very upfront about it, because I can only make it 3 days of early mornings. Back then in my 20s. Now in my 30s, I can only do 1 day, and I crash completely. But I knew I wouldn't make it through a full week if I tried to cover it up and just push through. So I would tell people in the job interview, and they'd be like, "Oh, that's nice. Yeah, fine. Thanks for asking." And I'd never hear from them again, because they can't fit me into the blank space that they expect, and that is the dehumanizing element of it. Maybe if people got to know me and knew my talents, and they'd be able to fit me into a situation where I was actually able to just work a small number of hours I could and do a good job, and kind of we'd have that mutual exchange where it wouldn't be so corrosive to my health, and they'd get an employee that they value out of it. But if people don't know you, they don't take that chance on you. Or if you can't do anything particularly special, if you're not a specialist, how do you become a specialist? Special skills, so they'll let you work short-term hours or late at night. You have to start at the bottom, work your way up. And that's where I was blocked. I couldn't even be an intern. I couldn't even get job bridge. They wouldn't even take me. So it's like, I guess it's that kind of outside expectation that you are going to fit into this machine. That is also true of all disabilities. It affects all of us in different ways. And
because it's like that, for any marginalization, you have to be exceptional to be accommodated or to be seen. And especially with if you've got any kind of issue that leaves with unpredictable energy, unpredictable wellness, a lot of people who deal with stuff like that would work flexibly, work for themselves, work in the arts, work as in sex work, in all of these sort of things where you have the kind of control and autonomy to be actually, I'm in a really bad pain flare. I have to stop doing this for a little while and kind of potentially take the hit.
It's being a person first. Which is why the Simone Biles thing, I burst into tears the second I saw it, because it is that insistence that, no, you see me, the person, and you see that I don't want to do this, or I'm not willing to make that sacrifice of my future just to please the audience or whatever. It's when you have that example of someone standing up to that at the highest level, I just thought that was incredible. Because that's exactly what they don't, the world is not going to look at Simone Biles and think, yeah, absolutely, whatever she wants. There are so many forces working against her that are just trying to use her abilities in service to their purposes, and that is work, essentially, boiled down to it. Your employer, pays you to carry out the labor for them. It's but the cost of doing that for some people is so high that it is cruel. It's cruel to ask that of people. But in current society, because we all have this pressure upon us to fit in and to live up to that standard in order to survive. It's been tied to our survival in ways that it shouldn't. Yeah.
So I found this quite interesting because, the framework in which I work doesn't allow any flexibility. If anything, it demands it. There is no such thing as a European Work Time Directive compliant work week in the HSE, and honestly, don't really care what my employer thinks. I'm going to go into a job that's going to be 20% worse than what I'm doing now in a couple of months. And to be honest, I don't think they equivalent. That's why they pay overtime. I don't have the option of flexibility, and I have a very variable disability. PMDD, the whole point of it is that for 2 weeks, I am the most spectacular person to be around. If I met me when I was well, I'd fall in love with me without a shadow of a doubt. And that's that. I get to be my most brilliant self. And the following 2 weeks are interesting. And what is interesting is being able to bring none of that with you. You can't, when people are so used to seeing you at a certain standard, you can't bring any of those challenges with you. When you actually apply for jobs as a junior doctor, if you apply for, as a regular junior doctor, you just put in all of your grades, whatever, and then you can fill in whether you have a disability or not. And Ireland is an interesting time of priding itself on the fact that, nobody reported disabilities entering Irish clinical training. Not a single fucking person. Like, not one person did. Whereas in the academic track, the track I chose, based on the half of a year that I am well, the academic track that the incredibly enigmatic, terribly brilliant version of me chose, you don't have the option of declaring that you're disabled. They monitor no inclusion data, because then they'd have to say that they don't give academic track jobs to people of color and migrants. They monitor no inclusion data because this is not a job that's designed to be sustained for people with disabilities. And they monitor no other inclusion data because then they'd have to admit that most of them are just straight lads from Blackrock. And
Yeah.
Having the top job in the country in that respect, as an unwell person of color who is queer and friendly and sex friendly, and we'll talk about these things, is a very, very strange space to inhabit. And I always find, on top of the egregious amount of work that gets done anyway, educating about disability is something that I have to do at every level with my employer, which is a challenge. I mean, I haven't had a moment yet where it has been taken in bad faith. It's only been 6 weeks, so read into that what you will. But it is a challenge. It's a challenge to go to occupational health and be like, look, I live with this. And their only response is, but sure, doesn't everybody PMS though? It's like, do your diligence, my dude. Just do your due diligence. You are also clinicians. It is a challenge to be like, yeah, I'll give the clinical teaching for this week to my entire department, including my consultants, and then talk about medications around PMDD, which I happen to actually do a significant proportion of my master's in, because the only way to say that I have a valid experience of talking about my condition isn't the fact that I've had to live with it for literally half of my life since puberty. It is to have said that I have done this to the highest standard of my master's.
Yeah.
As a clinician, the bar for clinical validity of lived experience of disability, of mental illness, certainly of queerness and transness. I mean, as a researcher, I was giving a talk recently about framing your research questions to get you the answers you want. And what a brilliant researcher once narrated on Twitter about getting rejected from a paper because the paper couldn't find evidence that trans people bind, because they had designed their studies so that it had never been documented that trans people bind. So the changes seen were logically unfeasible.
Yeah.
Yeah, as a clinician and an academic, doing the work of living with your disability and queerness is hard. Having to put in the extra time for education is harder, though it is always nice when the people you work with are like, well, you came in and you put in the hours to do that. At least you get paid for that hour you work. And I really appreciate my team for it. I'm very lucky. A lot of people don't do that. A lot of these conversations are almost mandated to take place in informal spaces.
Yeah.
Because, it's not something you talk about at work. It's something that you maybe have to talk about in a pub, spending money on your team to make friends, which is a huge challenge. And yeah, a lot of it can be either very ungratifying, or even if it makes you feel good, makes you very much realize that you've come out of your day with a lot fewer spoons than you'd expected. Because having that big conversation, or avoiding the big conversation and just forgetting to take your meds because it's hard to take them in a social space with doctors, is a really big thing. So yeah, I mean, it's being disabled. Like I always said before, I see disability as a function of not how unwell you are or not, but how that particularly interacts with your role in a labor force, or your role in production of art or production of work or whatever you're doing. And I think that is the part that is a huge challenge of disability to me as a doctor. Because my problem isn't that I have bad days. Like, yeah, they're shit. Like, they're really shit. But at the end of the day, the option to be able to manage them in a secure space rather than having to wait to accrue the adequate amount of sick leave, or to even have the good fortune that I do of a team who listen in good faith and understand that when you say you need to go, you need to go. That's not something that should be left to chance. And that is the sort of social and structural disablement of unwellness.
Yeah.
And as you said so well, the financial disablement of it, the outpricing of being able to live with your disability, to be able to be social in a community with your disability. That's the problem. The problem isn't that people are unwell or different.
Yeah, and it's a society that disables us, and yes, we might deal with illnesses and other things on top of that, but the lack of structure, the demand to be the teachable moment to the able-bodied people around you is just, it's like the biggest spoon stealer of all time. And like, if you, it shouldn't be luck, or it shouldn't be based on your personality or based on the fact that you excel when you're there. Like, there's so many ifs of whether you even get the space to be listened or get, like, because there isn't the protection there isn't the structures there. And I know, like, we've talked a lot about workplaces and workforce and that expectation, but to kind of bring it to our LGBT plus spaces, I know that some of our kind of community spaces are kind of learning to be more mindful of accessibility and ways that they can kind of adapt to people of all different needs. But what kind of ways do you think that spaces or events could be more accessible within our own community?
I'll give it a go.
I'll just
Okay.
Okay, I just wanted to say something short, and I think just like literally just to conclude what you were saying earlier, I think what would be nice, it sounds like a very broad strokes thing, is if it wasn't contingent, but it was accessible. And it was like intuitive. Then like that goes for a lot of things. I think that for me, it's just the idea of gatekeeping, or like that the accessibility wasn't contingent on, you know, either how queer you were or like how correctly queer you are for a certain space, much the same way how disabled you are. Like, I've certainly had my share of fights with people about, you know, but the physical disability is what matters here, and a lot of spaces will cater to physical disability or codified, you know, big brackets of neurodivergence. I think the only accessibility that I really want to see is one that isn't contingent on a label, but like that's kind of iterative and learns from itself and destroys itself when it needs to make something better, without it having to take a toll on other people.
Yep, Anya, you were going to come in there?
I mean, you said it much clearer and better. I was just going to say that, like, if we could just have spaces that didn't require us to have to do the work to make them accessible, that would be amazing. If it was just automatic that these things were thought about and talked about whenever a queer event is being organized, and like the diversity of disability and chronic illness and kind of the diversity of accessibility also needs to be like brought up at the first meeting to plan any event or any space. And I also feel like there's kind of like a gatekeeping of information, and like there's a lot of, like, I don't know, work put on us to find out whether or not something is accessible or how it's accessible exactly. And if it was just the norm to provide all of that information really clearly in different formats, that would be really helpful.
Yeah, no, 100%. Like even like on a Galway Pride side of things, like I know sometimes we've contacted venues to be like, what's your accessibility information? It's not on your website, or, you know, the page says coming soon or something. And they're just like, they just answer, oh, there's a wheelchair ramp, or oh, there isn't a wheelchair ramp. And that is the end of the conversation. And yes, that is important, but like, that's not what an accessibility information page is. Like, costs, like lighting, like space, like parking, public transport. There's so many other like ways that it's about accessibility or not. Are people allowed in your premises without spending money? Like it's a whole huge kind of area.
And another thing as well, that when everyone had to lock down and stay home as well, I think it became a little more clear, but literacy as well, like as a concept, it has evolved a lot to include like internet literacy, digital literacy, being able to get your phone to Zoom, you know, just have kind of an awareness maybe that like people aren't going to be able to look up all this stuff, follow your Twitter feed and keep up to date. You know, to have that one consistent place where people can come to check. And if you can have an in-person place as well, that can be super helpful if it's a local like situation. Yeah.
Yeah, I guess, yeah, all excellent points. The first thing, or the thing that came into my mind when you asked the question, like what can be done or what would be helpful, is even just the simple thing of offering the information, offering the accessibility information. Like it's a point that a couple of you have made already, but yeah, that was the one that really entered my head, that because I'm attending something, I don't want to have to go to email the stage manager, or like have to find out contact information for like no, like I just want to buy a ticket to something. I just want to attend something. Like I don't want to have to book a certain seat or like email to book a certain seat, or go through all these loopholes just to attend something.
Yeah. Like there's...
I was just going to say, and I think the only thing is, when people do that, I find it's a bit of medicalization that bleeds out into, well, all of society. Because it's always about, you know, oh, at least you have a spot. At least you have some quality of life, rather than just being able to, like, have a good proportion of things be accessible to a good proportion of anybody who can walk in the door. If you're constantly assuming that the best you can do for somebody is the bare minimum, I think any event or any space that deals with that deals in extremely bad faith. And do you know what? It's something that you see in medicine. It's something I can't make an apology for. And I don't want to, but everything is about, you know, but there's only so much you can do for somebody. And it's like, but you owe it to everybody to be able to do the best you can. Because everybody deserves to actually enjoy those spaces. We may be disabled in different ways. That doesn't make you any less queer or any less part of a thing you want to attend. Apart from the structures that literally limit it. And that's unnecessary. Like, any of that gatekeeping is so unnecessary.
Yeah. Even just like the assumption, like I have friends that like are wheelchair users, and like the assumption that you have to pre-book before you use public transport, because what if the bus isn't accessible? What if there's another wheelchair user? What is this? Where it's just there's no seemingly understanding that adults can be disabled and also completely autonomous and happy and trying to just do our best and live our lives, when with just needing, like, I don't even want to say accommodation. It's just like an understanding that we exist and we might also want to use these spaces.
Yeah. I actually, like, there's a phrase I want to throw out that, like, you know, this is not proper theory or anything, but I just found it useful myself. There was some guy in the 70s and he was studying psychedelics. He also was into hypnotism and all this stuff. And he coined the phrase consensus trance to describe how from the moment we're born, the culture that surrounded us, the people that teach us how to react, you know, and model behavior for us, we are basically hypnotized into a certain perception of the world. And that when that trance is broken, you actually start to realize what's actually there. And I find that useful as a reminder that, like, you know, like, imagine a hypnotist is like, you know, like, they can sit down with you and just through the power of suggestion get you to see a chicken in the room. But, like, what society has actually done to every single one of us is to train us to not see the multiple chickens in every room. You know, I call it the active chicken. I don't know. But it's basically like we have been trained not to see these barriers as actual barriers to our community and to all of us, just because it's not, oh, it doesn't affect me personally, so therefore it's fine as it is. It's not, because that could be you anytime. You know,
yeah.
A lot of the time, good health is not guaranteed, and anything can change so quickly. If it lasts, you know, a year and a half, how does anything, you know, so that you can be disrupted out of that trance very quickly, and then find not only can you see the chickens in the room, but the people in power are refusing to acknowledge that you might have a point, you know, and that's where a lot of the trauma of this comes from, you know, because you're utterly on your own then, surrounded by chickens. Yeah.
Yeah, no, I love that. I'm going to be thinking about chickens now when I'm thinking of, like, invisible illnesses, because, like,
ask yourself, where's the chicken? You know?
And, like, especially with, like, the pandemic and how we're effectively living through a mass disabling event, and we're reading about people pretending to be disabled for clout and other, like, horrendous takes where just trying to find a community of people who experience the same kind of things that you do, and that, like, your experience of living your life in your body is valid and enough sometimes, even if you're not studied, even if you're not, like, you know, the perfect presentation of the illness, just like it is in the book. But I guess just as we are kind of coming closer to the end of our discussion, which honestly, like, I could talk to you all for hours, and we probably will keep chatting, like, after this. But if you wanted to talk about what allies to our community could do, would you have any particular tips or any particular areas that allies probably need to work on a little bit more? So, anyone want to come in?
I feel like they also need to be asking for access and demanding access, like in the ways that we've all just talked about there. I do find it endlessly frustrating that we are the only ones that seem to be, like, trying to push this forward. And I mean, like you said, Anna, like, health is not guaranteed. They wouldn't only be fighting for us, but they would be fighting for themselves as well. So I think that, like, if you were going to an event and you see that there's absolutely no accessibility information and you're someone that has energy, like, contact them, ask them why, ask them what, convince them to put up access information in different formats, or because often we don't all have the energy to fight every time we're trying to go somewhere and we just give up. So please take some of that like burden off our hands, I suppose.
Yeah, no, 100%. Like being able to kind of like not speak over, but to kind of uplift and take some of the work out of that fight, where it's like, carry the load with us, because it's so important, because it can be so consistently difficult to have to fight for the right to access what everyone else around you can access. It's so difficult. But no, Claire, what about you? Have you any kind of areas that you'd really like allies to kind of work on?
I think what's popped into my head is to try and not be surprised when a friend or someone discloses to you that they're disabled, or that they have certain needs, or that we want to walk or move slightly slower, or that I won't make it because I've had a terrible day yesterday, like health-wise, or that it's normal for us. We're used to it. It's just our lives on the regular to have to deal with not feeling very well. Like that happens often.
Yeah.
And to just accept it, and I don't know, I suppose, that probably goes into privilege and ignorance around privilege and that sort of thing. But and then the accessibility information that we've discussed would be helpful also. Allies in the community. Yeah, I guess that's all I can think of.
Yeah, well, I think the not being surprised about people around you being disabled is actually really important. Like, especially when you consider, like, statistically 13% of the Irish population declare themselves as disabled. Like, that's people who are self-declaring as being like, I am disabled, so it's likely a lot higher. Like, other countries would nearly say 1 in 4, and with modern medicine and better like hygiene and things like that, like at some point we're all going to be in some way disabled. Sometimes it happens when we're young. Sometimes people are lucky enough that they get to a ripe old age before they start losing like some of the kind of expected like functionality. But Anna, what about you? What kind of tips would you give to the allies out there that want to do a little bit more?
God. I don't know, specific or broad, because like
we'll go broad maybe.
Oh, cool. Okay. Well, I guess try to become aware of the context of ableism and homophobia, like, and transphobia, like, fundamentally stems from white body supremacy. That is the driving central, bullshit that is harming everybody that can't keep up and like can't qualify under those like horrific like standards. So whatever your personal like area where like people often have like personal areas where they are marginalized, or like maybe it's someone's queer identity or something, like the more that you can kind of connect that to a fight where you actually have privilege, that you're on the kind of the other side of that power differential, but understand the similarities, because there is something behind all of this that expresses itself in various ways, but it does target anyone who is different, from this, bullshit acceptability. So yeah, that would be my kind of advice, I suppose, is to understand that like there are no like separate fights here. You know, there is a conscious step towards liberating people from these myths, because they're bullshit, they're false. You know, waking from, it's like, to bring back the consensus trans thing, I won't talk about chickens anymore, but you know, like the consensus is, you know, white supremacy, essentially. Like that, they're the people who dictated it, and we've all been like infected almost. We're like, we're carrying out the dictates off that. And then there's the trans aspect, where people kind of just operate on autopilot. They don't kind of want to think beyond. They don't get curious about, you know, if someone else has a different experience. Why is that? Assume that person's doing their best. You know, it's not something wrong with what they're doing. Then why is it different for them? You know, so there's a couple of elements to it. Is fuck up who gets to decide what the consensus is. Disrupt that wherever you can, and also get yourself out of that trance by being more like, I don't want to say mindful, but like, you know, have that kind of curiosity about what's actually going on here.
Yeah. Yeah, I think I really like that. I think that's a very proactive way that you could actually tell people, you know, these are two levels in which you could help. For me, I absolutely agree. I think something that really makes a difference in my life is when I feel perceived for my disability, which, you know, hard with hard with something that is not a physical disability. I'm trying to use the language of invisible disability less, because I think woefully ignorant of my disability is probably more appropriate. But I think when people perceive it, and, you know, I think a lot of people talk about, as you mentioned, Sharon, the whole, oh yeah, people are pretending to have illnesses for clout. I think very often in society there's this whole stigma against, you know, being like, oh, you're just allowing them to not try their best. You're allowing them to not overcome. I think being the kind of person who enables somebody to just go through their period of disablement, or the symptoms of their disability, or what their life is going to be like after a life-changing disability.
Yeah.
I think those are the best kind of people as allies. Like people who will turn around and say, you know, they won't say like, why does this take you an hour longer to do? They'll be like, you've done an hour's more work. This is great. You deserve to be paid for that hour. Yeah. Because like that is just how long shit needs to take for you. Because you deserve, as I said before, to not live your life by the minimum standard of life or quality of life, but being able to be the best version of you, however long that takes and however many resources that takes. Like there are big structural things any of us can do, and this applies to supporting any marginalized communities. But I think particularly at the intersection of disability and queerness, at a space where often there's this obligation to be out about who you are, or you were seeing, I'm sorry, I can't, I am too unwell. But yeah, where there's this obligation to either be out to access resources and access spaces, or to hide it away and be closeted and have this claim to privilege because you are not being who you are.
Yeah.
I think outside of the systemic ways, people who are genuinely willing to be safe houses and to advocate for you on an individual level, to be able to go through your life as disabled and still aim for the best things you want and have the best things you want. I think day to day, that's what a good ally is. Like that's what my best friend who is neurotypical is to me, who will create the space and, you know, be irritated or happy or whatever, but will still understand that this is a non-negotiable part of who I am.
Yeah.
That's really important.
No, and I think that's like such a lovely way of kind of summing it all up from all of you, because like, again, like like you don't know who you are or aren't advocating for. And I think that like sometimes, like, because a society that is ableist, that is homophobic, that is white supremacist, like it wants us to turn against each other and to be angry that that person gets help and I don't, and this person has it easier and I don't. And like we see it with like queer spaces when people will talk about bi plus people in different gender relationships, or people who aren't visibly queer, like of having this privilege when invisibility isn't a privilege. Like I feel like that nearly kind of comes with ableism as well, and disabilities, that sometimes I know I've been trying to be more mindful, but going from someone who went from having neurodivergencies to having kind of disabilities that are more physical, it's kind of like it doesn't always necessarily change how you're treated or how you're catered or not catered for, just because they can see that there's something wrong, or you're in the medical system looking for treatment or what have you. But I really loved this conversation and having everybody's input. So I'm going to do a quick just round of like closing remarks from everybody and we can finish up. We have technically gone over our hour, but honestly, like I don't think anyone watching along is going to mind staying with us for an extra couple of minutes. So Claire, maybe over to you for any kind of closing remarks.
Closing remarks. Let's see. Just that I suppose I'm grateful that we've had this conversation. But also, I suppose, going back to our accessibility things, as soon as I say I'm grateful for the conversation, I feel like, oh, well, I shouldn't be like, oh my God, yay, we had a disability conversation. But yeah, and to just normalize it, and that there's a lot more that allies can do to take some of the work off of us. But I suppose that's it.
Oh, that's great. Anya, over to you for your closing remarks.
Oh God, I don't know. Well done to everyone. You're also insightful and brought up such great things. And I feel really grateful to have been here and met you all virtually.
That is great. Honestly, like I could talk to you all evening. Shivani, over to you if you're feeling okay.
Hi, sorry. Honestly, I thought I did my closing remarks already. Yeah.
All good.
But yeah, I think thank you all for all of your insights. I think it's really, really important for me, like in my work and just as a person, to always see more of what disability means to people, like to see what effect our health and ill health can have on each other, and like the things that we all take for granted in our specific lived experience. And I don't mean that is in this good sense of good things, but even the things that we take as granted as being shit because we can't change them. It is really, really important to me that I got to experience some of your stories and for a little while understand the needs of different people who've had to unfortunately take a lot of things for granted that aren't great. And yeah, I wish you all well, and I wish everybody who has taken the time to watch this well in whatever journeys your health and illnesses take you in. And I can only hope that little by little we're building a space where to be who you are is acceptable, not by a standard, but just that to be who you are is enough. And to go through life as that is something that you could do with peace and safety and resourcing and happiness.
Yeah, that's lovely. Oh, thank you for that. Anna, your closing remarks.
Oh God. So chickens, right? This has been great. I don't really talk that much about my disability, I guess. So this has been really lovely. And just like, I suppose if I could leave people with a phrase to just kind of chew over, because it's something that I think is actually kind of a horror story in, half a sentence. But it's also thrown around a lot. And that is the phrase "to earn a living." Just like maybe just kind of sit with each part of that and think about it, because do we really have to do that? Like, is that really why humanity evolved? You know? So that's my little gift. That and the chickens, okay?
It's like we do not dream of labor. But yes, no, it's been fantastic. We do dream of chickens. But yeah, no, thank you so much for all of our contributions and for you for watching it. We do have a couple of in-person events that are going to be on this evening. We have our BTQIA plus tea party in the park, in Fotherbrook Park here in Galway City. And then we are having our Queer Women's Night then after that. But we'll have plenty more remote events that'll be coming up all weekend long. So thank you for joining us. So bye.